Hi, Dave Butler here with Align Therapy. I'm going to demonstrate exercise number 9 of our 10 exercise series on simple and easy scoliosis exercises. These exercises, and this one in particular, isn't necessarily specific to scoliosis. This is something that can be done by anyone with, say, back pain or kyphosis or any spinal issue. This is an exercise that's fairly easy to do at home without equipment. And you can do this usually without any pain. If you're having pain with this exercise, stop and consult with someone who knows specific exercises for back pain. A Schroth therapist would be great, someone who's been trained in that. So don't forget to subscribe to the channel. Make sure that you check out our other videos in this series. There will be 10 exercises in this series that will all be linked in the description. So check those out. A lot of them are good to do with just general back pain as well. So this exercise is a core strengthening exercise working on a muscle called the transverse abdominis. The transverse abdominis has there's a lot of videos out about transverse abdominis activation. And some of them are great, some of them aren't so great. So I'm going to go kind of basic with transverse abdominis exercise and activation. The reason that we're using the transverse abdominis is the transverse abdominis is a really deep abdominal muscle. It goes all the way around from the abdominals all the way around to the thoracolumbar fascia. The thoracolumbar fascia is in the back here with a lot of muscles attaching into the thoracolumbar fascia. And the transverse abdominis goes all the way around, and when it contracts, it actually pulls in, kind of like a weightlifter's belt or a girdle or something like that, that increases stability. We already talked about abdominal pressure in one of our other exercises, and this muscle helps to increase abdominal pressure, which helps to stabilize the spine. The transverse abdominis is one that is not very active in people with back pain. During pregnancy, the transverse abdominis kind of turns off because it lengthens out so much that it can't contract anymore. So it's a very important muscle for stability of the spine, and it's sometimes a very neglected muscle for stability of the spine. With doing general core exercises like sit-ups and crunches and things like that, it doesn't really activate this muscle. The hard thing about the transverse abdominis is we can't add weight to the contraction. Because it contracts and pulls in, there's no way to increase resistance for this exercise. So what we have to do is we challenge your ability to hold the transverse abdominis contraction while you do something else. So I'll demonstrate that and show you what I mean by that. So first of all, when I teach people to activate the transverse abdominis, I almost always have them laying on their back. That allows them to feel what's going on, and it takes a lot of the fighting against gravity away. We do want to do this exercise progressing to weight-bearing activities, but at first we want to learn how to contract it without that. So you're gonna lay on your back, and the first thing is you're gonna find your hip bones. So the pokey bones on the front of the pelvis. So just find those. So they're right there on me. If you go like your abdominals, your ribs and your abdominals, and then you can feel just to the sides of those bones. You're gonna touch those bones and then kind of fall off of those bones towards the inside, down into the muscle tissue. Then, after you find those two spots, you can use one side or both sides. Then you're going to tighten the muscles just underneath your fingers. So sometimes it's hard to figure out how to do that. That muscle tightens when you laugh. So laugh a little bit and see if that tightens. You can also tighten that by just drawing your stomach in, not sucking it in, but drawing it in, tensing the muscles and pulling that in, activating that transverse abdominis. You should feel underneath your fingers that the muscle tightens in that spot. We're not trying to go for like a crunch or a sit-up or anything like that. We're just trying to add some activity to that muscle and tense it up. So watch for a couple of things. Watch for that your stomach is drawing in
and that you're not pushing out with your stomach. Also, that you're not seeing a peak form here. Sometimes there's something called a diastasis or a diastasis recti, where the abdominals actually have a weak spot in them. So watch for that. Make sure that you're not, that it's not poking up like this, that you're drawing back. The other thing is, second thing, don't hold your breath. So tightening the abdominals, not holding your breath. I'm tightening right now, but I'm still able to talk normally. And you should feel that staying tight. So after you get that down, after you can do that pretty well, the next step is that you tighten the transverse abdominis, and then we add some challenge to it. So the first challenge that I usually have people do is tightening here, and then they're just going to raise one foot off of the table and then put it back down. Raise the other one, put it back down. If you notice, I'm going nice and controlled. I'm not marching like this. I'm staying nice and controlled. So keeping that tight while you march, keeping that tight, extending the leg. Again, nice and controlled the whole time. You can progress to where you're doing like a reverse march, where you're tightening and then touching the table like this. If you've heard of a dead bug, I like to call a dead bug a dying bug because they're not quite dead yet. Transverse abdominis contraction, arms and legs up like this, and then lowering one arm in the opposite leg. Or you can just do the arms. You could put the feet down and do this with the marching. There are a ton of variations, but the idea is we're challenging the ability to maintain that transverse abdominis contraction while you do something. So then after you get good at that, after you can activate the transverse abdominis and control it, you can do it in sitting. So sit up, you can still push on the same spot, tighten the transverse abdominis, don't hold your breath again, and try that in sitting, try that in standing, and then you can incorporate a transverse abdominis exercise into any exercise. You could be doing a bicep curl and holding a transverse abdominis contraction. So really it's something you can do with anything. You can do that during normal activities of daily life. You can activate the transverse abdominis when you're lifting, which is a great idea to add stability to the spine. Like I said, this isn't a scoliosis specific exercise, but it is an exercise that will help you to create more stability in the core muscles, which will support your spine and help those other things that you're doing for scoliosis to go that much better when you have more stability. So hopefully this was helpful. Hopefully you found this exercise useful to you and that you're able to do it. If you have questions specific to the transverse abdominis activation, please leave them in the comments. And if you are looking for specific treatment for your curve or your condition, feel free to reach out. We'd love to help you. Thanks for watching.